The basic steps in your daily workflow include updating your problem list, checking your orders, ensuring an adequate tertiary exam has been performed, write your progress note, refine the discharge plan, and update the brief hospital summary. These steps are presented in this specific order to make your process as fluid as possible. Please refer to the daily checklist under the Workflow tab of the iTrauma website. The problem list should have every condition for which we are following clinically, radiographically, or with repeat labs. First, check the admission medication reconciliation to ensure that all chronic conditions are on the problem list. Next, go to Results Review and review your labs, vitals, and imaging to ensure that all important diagnoses are on your problem list. Then review operative reports for important intraoperative findings and diagnoses, and review any other pertinent diagnostics, including EKGs. Complete the admission medication reconciliation if the pharmacist reconciliation has been completed or if you are confident of the patient's home medication regimen. If there is a green check mark next to the Meds History icon in the top right-hand corner of the Medication Orders tab, then you know that the pharmacist reconciliation has been completed. If the pharmacist reconciliation is incomplete and the patient's home medications are unknown, or if the patient has some important home medications to resume, vocera the T11 or shock trauma pharmacist and request an expedited medication reconciliation. If this is your first day with a patient, or if home medications have been held previously, for example, antihypertensives held for hypotension, then recheck the admission medication reconciliation. Review all orders every day and make sure to clean up any inappropriate orders. Check to make sure that the appropriate diet is ordered and that there is a true indication for any IV fluids that might be ordered. If a patient is on bed rest, make sure that it is truly indicated. This would be for patients with TBIs with acute or anticipated ICP issues, new high-grade solid organ injuries, or highly unstable fractures where bed rest is requested by the consulting service. Bed rest should not be ordered on patients with spine fractures requiring upright imaging in a brace unless otherwise indicated. Oftentimes, you will notice conflicting or multiple activity orders. Please make sure to clean up any of these orders and update weight-bearing restrictions post-operatively. To ensure responsible narcotic use, you should calculate the 24-hour MMEs every day. The easiest way to calculate MMEs is to go to the Rounds Report Pilot as shown on the screen. The Rounds Report Pilot will nicely add up all of the narcotics used over the last 24 hours. You can then easily convert these to MMEs by going to the iTrauma website and using the MME calculator.
The goal of treating trauma patients is to treat life-threatening conditions first. During the initial assessment, the ABC approach is meant to treat any condition that is an immediate threat to a patient's life. When these conditions have been addressed, the secondary survey is performed. The secondary survey is a thorough head-to-toe exam, noting any signs of trauma. The goal is to identify all injuries sustained by the patient. Many factors can cause injuries to be missed, including, but not limited to, a patient's mental status, such as a head injury or chemical in the system, distracting injuries, internal injuries without symptoms. Due to these factors, the best practice in trauma care is to perform a tertiary exam after the initial acute phase is over. The tertiary exam is a repeat of the initial trauma evaluation. It consists of looking and palpating the entire body from head to toe. It is best if this can be done in the first 24 hours after admission to the hospital. A tertiary exam can and should be performed on an unconscious or altered patient, but it would not be considered adequate. To perform an adequate tertiary exam requires active participation from the patient. The point is that the patient can identify areas that hurt, both areas that have been hurting since the event and also new areas of pain that they had not yet noticed. If the tertiary exam is performed on an unconscious or altered patient, the exam should be repeated as soon as the patient is in a condition to participate in the exam fully. This is a demonstration of the tertiary exam. Before I've come in to examine the patient, I've already reviewed all of the x-rays, CT scans, the list of patient's injuries, and I've reviewed the physical exam from the primary survey to be able to compare this exam to that exam. If the patient is not completely conscious and participating, the exam should be completed, but recognizing that it's not an adequate exam, and in order to obtain an adequate exam, the patient needs to participate. The point being that they can identify areas of pain that they didn't notice before. Trent, do you have any pain in your face?
No.
When I push on it, it feels okay?
Mm-hmm.
When you put your teeth together, do they fit together normally?
Yes.
I'm looking at the scalp and examining the face for any bruises or wounds that may have not been recognized before, and I do not see any. I'm going to push on your collarbones here. Does that hurt at all?
No.
I'm going to push on your neck. Do you have any pain in your neck?
No.
When you move your neck, does it hurt?
No.
I'm going to push on your shoulders. Do you have any pain in your shoulder joints?
No.
I'm going to push on your chest. Does that hurt?
No.
And in your rib cage, any pain?
No.
I'm going to push on your elbow and your wrist and your hand. Any pain with that?
No.
Can you squeeze my fingers really tight? Good. The same thing on the other side. Does your elbow, wrist, or hand hurt?
No.
Give me a good tight squeeze. Good. I'm going to push on your belly. Does that hurt at all?
No.
No pain? I'm going to push on your hips. You hurt in your hips?
No.
Trent, I'm going to take a listen to your breath sounds. Will you take a deep breath for me? Again. Thank you. The external genitalia should be examined if there's a high suspicion for an injury. If it was completed in the primary survey and documented, it could be deferred here. Trent, I'm going to roll you up on your side and check your back. As I push down your spine, you let me know if you have any pain. Does it hurt here? No. No pain along the entire spine? No. Very good. Go ahead and roll back. I'm going to push on your thighs. Do you have any pain in your thighs?
No.
How about in your knees?
No.
Pushing on the fibular heads, this is a particular area that's a common missed injury. No pain here, Trent?
No.
Ankles?
No.
Feet? No pain. When I touch you, is it normal?
Yes.
On both sides?
Yes.
Push tight against my hands, up towards your, good, very good. With the tertiary exam now completed, I'm ready to document this in the patient's chart. Once the tertiary exam has been completed, the findings must be documented. The tertiary exam can easily be incorporated into a daily note on the day it is completed, or it can be documented as a separate note. When titling the note, it should include a tertiary exam. Example, daily progress note with the tertiary exam, or discharge summary with tertiary exam. The components of the tertiary exam that should be in the documentation includes adequacy of the exam, the complete head-to-toe assessment, spine clearance or known injuries, new findings or symptoms of pain or trauma, and finally, additional exams ordered with the findings of new pain or symptoms. In iCentra, there is a template available for this documentation. By typing .t_r TERT, this template will be placed in your note. To complete the note, the exam should also be documented. .t_r EXAMLONG will also produce a template in iCentra for documenting the exam.
You can find your Progress Note templates in the Specialty View Manage tab. The note titled Trauma Progress Note is your generic floor note. Please document a proper note including subjective, objective, assessment, and plan. For a typical note, you can use the phrase .tr exam brief. For tertiary exams, use .tr exam long. Your template for the note in assessment and plan is .tr floor. All problems should be commented on in the assessment and plan. Don't forget to include your name here at the bottom above IMC Trauma Services. For an ICU note, click the Trauma Critical Care Progress Note. Do all the same things, but in your assessment and plan, type in .tr ICU. When saving your note, make sure to include in the title and tertiary exam if a tertiary exam was completed. It's extremely helpful if you can prepare any discharge information for people who are taking over your patients. Follow-up in particular can often be put in before discharge. In this case, this patient is follow-up Dr. Hawes and Dr. Nathan. Orthopedic surgery and neurosurgery will both put in their own follow-up information. If they have signed off from a patient, please ask them to put this information in if it is not. They also will put in their own patient education. At the bottom of your progress note, you should include the dot phrase .trdc and make sure that this information is updated daily. Lastly, make sure to update your brief hospital summary. In particular, make sure that your RAP score is updated, as this may change based on new surgeries or new findings of injuries. Please make sure that your tertiary exam date is entered and that you put in the daily events.